Hey, Dr. Tam here. So today I want to show you who gets misdiagnosed with carpal tunnel. Now, a lot of you might have gotten misdiagnosed with carpal tunnel. Maybe you were diagnosed with carpal tunnel, but you're not sure if you have it or not. Some people and some of our patients have had surgeries on one hand. It didn't work. After a few months, they got another surgery and then eventually another surgery on the other side. So today I'm going to explain to you what carpal tunnel actually is. So what is carpal tunnel? Carpal tunnel is pain going from here, okay, down into your hands. Carpal tunnel does not make it down the forearm. That's not called carpal tunnel. That is something else. So what is a carpal tunnel? When you have pain, it's called carpal tunnel syndrome, but there's a part of your body that's actually called the carpal tunnel. It's a band of muscles that goes right across the crease of your wrist over here, and your muscles from your forearm goes underneath that sheath into your hands. So what happens is when your hand contracts and when you're making a fist, those muscles expand, right? And you can feel when you're making a fist, if you're squeezing a fist, well, your forearm is more tight. When you are letting go and relaxing your hand, those muscles underneath the carpal tunnel relaxes and flattens out. Now, what is carpal tunnel syndrome? Carpal tunnel syndrome is when that sheath of muscle is so inflamed that it's taking up space of the muscles for it not being able to expand underneath. And that is exactly why when you try to grip something, it hurts, and when you release, it feels better. So one of the first things you need to do if you really truly have carpal tunnel is you want to do this. You want to bend your hand down here, okay? And if you feel a zinger as you're doing this, going down the arm, from here down into your hands, yes, that is absolutely carpal tunnel. You can do it to this side as well as you're pressing down and you're feeling pain coming down your hand. Or if you're doing this and you're feeling pain going down both hands, yes, that is carpal tunnel. But wait, what if you're like, well, Dr. Tam, when I do this, there's actually no pain, but when I'm gripping, there's pain. Now that potentially may not be true carpal tunnel. Up to 50% of carpal tunnel syndrome is actually misdiagnosed, and the real true problem is actually coming from the elbow, shoulders, or the neck. Well, since we started with the neck, let's start there. How does it cause problems with the neck? I want to show you, okay? In our spine, you have the brain stem right up here. You have the spinal cord that's right behind the bones. And we're looking at the neck. Imagine if you're looking at me right over here. We put a little BB right there, and that's why the BBs are light up over here as two white spots. But when you look at this, you have a lot of good spaces between the bones over here. So between bone number 2, which is C2, C1, 2, 3, 4, 5, 6, 7, you have good spaces between 2 and 3, 3 and 4. But what happened is between 4 and 5, right there, well, look at that compression that you have there. And between bone 4 and bone 5, that's nerve root number 5, C5 nerve root, which is one of the nerves that control your hands. But C6 and 7 and 8 also control the hands in different areas as well. So that's why problems with carpal tunnel can sometimes easily be misdiagnosed, okay? And the original problem is actually coming from your neck. Now you're thinking, wow, you're not sure where it's coming from. Well, did your doctor ever did the exam? Did they ever did an exam on your neck, shoulders, or elbows, right? Sometimes in shoulder impingement can cause zingers going down into the hands. Sometimes an elbow impingement can cause problems in the hands as well. How do you know which one it is? Well, hopefully your doctor have done a great job at diagnosing your problem by taking you through a thorough exam, taking x-rays, to really try to find out what the true cause of the problem is. We've had patients who've had both hand surgeries, and eventually their hands still go numb because of all the scar tissue and repetitive surgeries that they've had. And once you have one, you can't go back. So if you want to find out more whether or not you have carpal tunnel, feel free to do this exam, right? Make sure if it hurts, don't do it anymore, okay? Or if you start to feel the pain coming on, that means stop, right? See a specialist. If you're close by to us, seek us out, or find your nearest chiropractor to see really what the true cause of the problem is. Until next time, have a great day.